nutrition for the growth and development of the infant. The maximum growth and development of the infant occurs during the first 6 months rather than any other phase of life. So today on the occasion of World Breastfeeding Week, I am going to present on common lactational problems and their management. So it is divided into the problems due to mother and the problems due to baby. So the first and the most common problem that is encountered is the insufficient breast milk. It can be due to delayed initiation of the breastfeeding after birth because of cesarean section or prolonged and exhaustive vaginal delivery. And one of the most important is the incorrect method of breastfeeding. We should counsel the mothers regarding the correct positioning and the correct attachment. For the correct positioning, the baby should be held and the head and the body should be at the same line, and the abdomen of the baby and the mother should touch each other. Regarding of the attachment or the latching, there are 4 signs of good attachment. Chin touching the breast, mouth wide open, the lower and upper areola more visible, and the lower lip everted. We should counsel the mother that bottle feeding is not at all beneficial because it interrupts with the nipple identification. Moreover, it itself is a reservoir for various infections and can lead to diarrhea. We should counsel the mother that breastfeeding should be continued even at night. The breastfeeding should be frequent, adequate, and on demand. And then another most important factor is the maternal stress. Stress hinders the oxytocin reflex, and we should ensure that the mother gets adequate amount of breast, fluid, and emotional support from the family. We should reassure the mother that if the baby is sleeping 3 to 4 hours after the breastfeeding comfortably, and the baby is urinating 6 to 8 times per day, and the baby is gaining the weight properly, then the breast milk is adequate. And there are some other factors for the lactational failure, such as primary hypopituitarism, hypothyroidism, Sheehan syndrome, which can hinder the breastfeeding. Also, it can be due to hypoplastic breast of the mother, for which antenatal examination of the breast is essential. Now we come to the second problem, is the sore or the cracked nipple. The nipple becomes sore if the baby suckles on the nipple vigorously rather than the nipple and the areola together. As a result, the baby cannot get adequate amount of milk, and the baby becomes frustrated and it suckles vigorously the nipple and often bites the nipple, which leads to the sore and the cracked nipple. The remedies include correct positioning and the attachment, application of the hind milk, and oral analgesics. The next problem that we often encounter is the inverted nipple. The inverted nipple occurs due to the fibrosis in and around major milk ducts. It makes the latching difficult. Syringing treatment has to be done. Coming to the next problem, which is breast engorgement. The lactation increases rigorously after 2 to 3 days of delivery. Infrequent and insufficient breastfeeding or expression of the milk can lead to increased venous pressure and engorgement of the lymphatic channel, which causes the breast to become hard, burn, tender, and with shiny skin. The treatment includes hot fermentation, massage, frequent feeding and expression of the breast. As the breast become hard, if the baby finds difficult to find the nipple. As a result, it can also lead to the cracked nipple. This cracked or inverted nipple can itself act as a path for the spread of infections, which leading to the cellulitis, or commonly called as lactational mastitis. If this mastitis is remain untreated, it leads to suppuration and abscess formation. The treatment includes ultrasound guided drainage and aspiration of the abscess, and if the abscess is large, it has to be drained by the vacuum-assisted suction. Even in this figure, we can see the mother is continuing her breastfeeding along with the vacuum suction being continued. The mother is encouraged to continue the breastfeeding throughout the process. Now we come to the problems due to baby. The first reason is the prematurity. We know there are three reflexes that are associated with breastfeeding for the baby: rooting, suckling, and the swallowing. All these reflexes are absent in 28 weeks of gestation and are weakly developed at 32 weeks of gestation, and although the coordination is not well developed, it is often associated with a pause after restriction. These reflexes are well developed as done at 38 weeks with well developed coordination of swallowing. Temporary illness such as respiratory tract infection, lethargy due to jaundice, and also oral thrush. And third cause is the overdistension of the stomach with swallowed air. This can be overcome by burping the baby for few minutes after feeding every time, even after night feeding. Congenital malformations such as laryngomalacia, ankyloglossia, cleft lip, and cleft palate can interfere with the latching. The cleft lip needs surgical intervention. Till then, the baby can be given expressed breast milk according to their convenience. Now the expressed breast milk can be given to the baby if the baby or mother are sick, or the baby is premature, or there are certain factors developed when the mother is unavailable or not able to produce milk. There are certain steps for expressed breast milk. To express the breast milk, for that the mother has to gently massage the breast first. Then she should keep thumb and the index finger opposite at just beside the areola, and push that towards the chest. Then, by gentle squeezing, she has to express her breast milk. Nowadays, the pumps has been developed, many mechanical and electrical pumps, to take out optimum amount of breast milk. The human breast milk can be stored at room temperature for 4 to 5 hours, at freezer for 24 hours, and minus 20 degrees centigrade for 6 months. Human breast milk banks have been developed by taking the milk from the mothers who are voluntarily giving the milk, and are supplied to the needy children by palate or orogastic. Lactational management centers has been developed throughout the India under National Health Mission to screen and supply the breast milk. After screening for the several parameters, they have been pasteurized and are supplied to the children. Baby-friendly hospital initiative has been taken by World Health Organization Foundation and UNICEF to promote and support breastfeeding. In the developing countries like us in India, there are no contraindications to the breastfeeding. Still, there are many myths, many cultural and religious customs associated with the breastfeeding. And one of the most common is giving pre-lacteals such as honey. This should be banned, and it is not this can be harmful for the baby also. We should counsel the mother that breastfeeding is not only essential for the baby, also it prevents the mother for various diseases.